Hello everyone, this is Dr.Huma Ibrar. I hope so you all been showing your good health. So today I'm here with the latest DHA exam MCQs from past exam. First of all, I would like to apologize for posting video after a long time. I couldn't manage because I have to travel internationally. So let's move towards the topic. But before starting, if you still haven't subscribed my channel, kindly subscribe my channel and don't forget to click the bell icon, as this channel is all about international license exam material and guidance. DHA questions from October 2023. So here are some topics of latest DHA exam. In which axis abduction and adduction takes place? In which plane abduction and adduction takes place? Brodie's abscess, that is subacute stage of osteomyelitis. What primitive reflex takes place in 6th month? That is sitting. Dupuytren's contracture. At which month baby identifies mother? 7th. Patient leaning towards left. Which side abductor is weak? 8th one. Uncompensatory leaning of trunk towards left. 9. Tetralogy of palate. 10. Periarthritis shoulder. 11. ACL. 12. Ultrasound parameters. 13. Shortwave diathermy. 14. Bronchiectasis. 15. Quadrant test. 16. Sternocleidomastoid action. 17th. Quadriceps EMG electrode placement. Option will be wider. Correct option will be wider. So 18th one, a patient undergone muscle tear after sports. Acute stage cryotherapy will be the correct option. 19th, calcium channel blockers action. 20th, at which heart condition to stop treadmill exercise? Arrhythmia, drop of BP, or sweating? 21. Cool down period benefit. Manage tachycardia. 22. At which blood sugar level exercise is contraindicated? Parkinson, which is not a characteristic of Parkinson. 24. Respiratory acidosis, that will cause disorientation. 25. Heel strike, GRF shift towards which part? That is ground reaction force shift towards which part? 26. Initial management in CP, neck control. One question to identify example, that is from liver. 28th, lead pipe rigidity. Uniform rigidity is seen in Parkinson's patient. Sagittal plane action, flexion, extension. Plantar flexion, dorsiflexion, axis of movement. Bottonier's deformity. 32. Post-operative period, duration of immobilization. 33. Lashman test. 34. PCL, posterior cruciate ligament, hyperextension or hyperflexion injury. 35. That is platelet count, normal range of platelet count. 34. Heart outer layer, that is pericardium. 35. Lunate palpation. 36. Sciatica. 37. Compensation of forefoot supination. that is subtalar pronation. 38, scaphoid pad. 39, toe walking, that is plantar flexor acting. 40th, image of bicep given and identify which muscle is this. 41, shoulder retractor muscles. Okay, 42, carpal tunnel syndrome. 43, medial border of foot. Nerve root. Okay, which nerve root is supplying the medial border of foot? Yes. 44, Erb's palsy. 45, motor reflex. 46, quadriceps supply, L4. Peroneus muscle action, 47. 48, which primitive reflex is attained later? 49, 9-month baby milestone, that is pulse standing. 50th, forced expiratory volume and forced vital capacity. Related questions. 51, DMD, that is Duchenne muscular dystrophy. So that's all for today. Thank you for watching this video.